Hi, welcome to Habitual Excellence. I'm Mark Graben, and we're joined today by Leah Binder. She is the president and CEO of Leapfrog Group. Leah, how are you?
I'm good. Thanks for having me,
Wow,
Mark.
I'm glad you could join us. And Leapfrog Group, to me is a very meaningful organization. The mission and the work that you've done for 20 plus years. Can you tell the audience, if they're not familiar with you and Leapfrog Group, tell us about the organization and some of the background and what you do and why?
Sure. Yeah. Leapfrog is a nonprofit. It was founded 20 years ago by employers, mostly executives at large corporations who were concerned about the cost and the quality of healthcare delivered to their employees. And also, they were concerned that they didn't know about it. So there's very little information available either to them or to their employees to choose among healthcare providers. So they founded Leapfrog as a means of collecting information from particularly hospitals at the time, but collecting information from hospitals, publicly reporting it, and allowing their employees to make informed decisions, and also giving them tools so they could structure their health benefits to start to reward excellence as opposed to just pay for whatever comes along.
Yeah.
They also had a very deep level of concern about safety in hospitals. And we all know that even today, safety problems like errors, accidents, infections in hospitals kill 500 people a day
Yeah.
from completely avoidable reasons. So they were very concerned about that and wanted Leapfrog to really help to drive change and work together to do it. So that's who we are. We still collect that data. We still publicly report it. We're a little more sophisticated than we used to be, a lot more
Yeah.
in terms of how we can report it because the science has advanced on how we can measure quality. But we still are fundamentally about driving a market for excellence in healthcare in the United States.
Yeah. And you talk about payers, employers, individual patients. If we're placed in the situation of choosing where to get care, how much progress has there been in terms of information about quality and cost? And it's still kind of hit or miss. Or we still have work to do, I guess, right?
I think we've made a lot of progress in hospitals.
Hmm.
So I think we have more information than we used to, a lot more about how hospitals are doing, and particularly around safety, but also on some outcome measures. Most of the outcomes we have, which are really important to people, right? You want to know if I go in for surgery, am I going to, how's it all going to turn out? What's the likelihood it's going to go well? How am I going to be at the conclusion of that surgery? And that's so fundamental, it's outcomes. And so we tend to have outcomes measures, so really good scientific, valid, tested measures that are about one outcome, death, which is, of course, we all want to know, will I survive a surgery? So it is an important outcome, of course.
Right.
We also kind of want to know for surgeries that don't have a high death rate, thank God, like knee replacement, am I going to be able to walk on that knee? How's it going to go? Am I going to get an infection? Or, when am I going to get out of bed? How fast? So those things, we're really far behind on getting those kinds of nuanced measures, but those nuances are really important to people. We don't have those. And in terms of measurement of physician and provider, individual provider quality, I think we're very far behind, to be honest.
Hmm.
We know very, very little about the kinds of things people really want to know about their doctor. Like, is this doctor, do they make a good diagnosis?
Mhm.
Are they, we know something about how people feel about whether they're friendly and listen well. That's important to people. So that
Sure.
we do have fairly good information on that. But we're really behind on clinical measures about the effectiveness of individual physicians.
Yeah.
And then we know remarkably little about outpatient surgery, even though 60% of surgeries are done there. And we know remarkably little about nursing home quality, even though we've tried for years to get at that.
Mhm.
So I think, so I guess the answer to your question is that in some ways we're doing very well, and in some ways we are just really inexcusably behind where we should be.
Sure, sure. And one thing that Leapfrog Group has done, I mean, you talk about the more detailed measures. A lot of it starts with a letter grade, And I know from your website you can then drill down into that. But can you talk a little bit about the role of the grade and the measures? I know the point is not just to issue the grade. The point is to help improve the healthcare system. Can you talk a little bit about some of those dynamics and what that's led to?
Sure. Well, the letter grade started because when Leapfrog started 20 years ago, we began with the idea that we were going to ask hospitals on behalf of large companies that do a lot of business with these hospitals. We're going to ask them to voluntarily give us information on their safety. So we asked them how they're doing on errors and accidents and infections to the extent we could ask the question. We asked them. And then we publicly reported the hospitals that voluntarily gave us the information. But, there is a problem with voluntary surveys. And the problem with a voluntary survey is some people don't volunteer.
Yeah,
And you
sure.
particularly aren't likely to volunteer if you're doing badly, right? Especially if you're a really well-regarded hospital. So you might have a big name and you know that your infection rate's bad, and that happens a lot. I can tell you that right now.
Mhm.
Why should you give Leapfrog that information to publicly report? It's not to your advantage. You might as well just ride on your reputation. Why should you allow it to be out there? So, of course, that's a major problem and it's a fundamental issue. And I think our board recognized that because after the 10th anniversary of a report called To Err is Human, which is a report on safety that really blew open the whole problem of patient safety in this country.
Right.
So after that came out, there was a lot of reflection on it 10 years later on did we get anywhere? And the answer was no. The data was not good. And Leapfrog had to look at ourselves and say, oh, do we have the right model? Is it a good idea to give people this information to allow them to make choices and collect this information? And what's the problem then? If we still think our model is good, then what can we do better? Well, I think we came to the conclusion that the voluntary aspect of it was a problem. So we have worked for many years to try to get CMS to require hospitals to report this information. They did that,
Yeah.
particularly as part of the Affordable Care Act.
Mm.
Hospitals are reporting in a really required way some of their safety data. So we brought together foremost experts, world experts really in patient safety, and asked them to come up with a way to bring all that CMS data that's publicly reported that is required, bring it together into a meaningful composite measure.
Hmm.
We would add to it other measures that are publicly available. And it turns out Leapfrog itself, our survey, had some excellent measures. We have some superb patient safety measures. So we put those in as well. But if hospitals don't report, we can still give them a grade. We figured out a way to do that. So we brought all these experts, and it took a lot of time, but we're very rigorous and careful and transparent about it.
Hmm.
So the whole methodology is laid out in exquisite detail if you want some bedtime reading. But we give you the whole methodology,
Yeah.
and then we assign it a letter grade.
Hmm.
And that had a real impact.
Hmm.
And that is where we started to see the kind of progress that we want to see. We're seeing progress in infections. We're seeing a lot of progress. I'll tell you the progress that I'm most excited about is currently anecdotal, but we're asking about it in a more rigorous way now. And that is that hospitals are actually tying incentives for their senior leadership, financial incentives, to the letter grade.
Great.
And what we know, what that means is we're suddenly uh, tying compensation of leadership
Hmm.
to safety. And suddenly safety is emerging as a higher and higher priority in the
Right.
C. That is that's a home run for us. That's a
Hmm.
really important thing for
Yeah.
hospitals to recognize safety that way.
Yeah. That's a win, and to have a more balanced scorecard in the C-suite in terms of what they're
Yes.
incentivized for.
Yes.
But yeah, I mean, so you talk about voluntary versus required mandated reporting. I mean, I would look at it as a healthcare consumer, as a patient. I would look down on an organization that wouldn't voluntarily report. I said, well, that I think that says something, or
Yeah.
said.
Actually, we did market research prior to putting out the grade, and well, we do it in a continuous way anyway. And consistently, we were asking people what they thought of patient safety. So if you ask someone what they think of patient safety when they walk in a hospital, most people will say, well, I do think it's important that they have really good fire safety mechanisms, that they have the right, that they're inspected. I mean, people don't necessarily like recognize the term patient safety as meaning errors, accidents,
Right.
infections.
People aren't aware.
They aren't, but when you say what we mean by that is like medical errors and infections, they say, "Oh God, yeah, that's really important." Everyone has a story because we know
Right.
this happens all the time.
Yeah.
Everyone, my uncle got an infection and this happened.
Hmm.
My aunt, my this, my that. Everybody has a story, and they are animated about it. And to your point, Mark, if you when we show them like ways of portraying the grades or ways of showing people ratings, consistently, the thing that consumers get most exercised about, the thing that really upsets them most of all, number one, beyond, and we tested things like, would you get upset if you found out a hospital had a lot of objects left in after surgery, like they left the sponges in a lot?
Hmm.
Would you get upset about that? Well, yeah, that would be, I would
Right.
have to talk to my doctor about that. But if you say to them, they declined to give information about their safety record, they get very upset. I
Hmm.
mean, that by far is the most upsetting uh, rating you can give a hospital.
Yeah.
Not transparent.
Interesting. Yeah. Yeah.
I always tell hospitals that you're better off laying it out because people will forgive you for your mistakes, but they will not forgive you if you're trying to hide.
Yeah, and when you talk about these things being avoidable, preventable, I think one challenge. I mean, I think that there's still this tendency to blame individuals. I think amongst the general public,
Yes.
who screwed up instead of the way we might look at it is more systemic factor, and so I think there's a lot of education that would be beneficial along with this transparency and help people know, like, if an item's left inside a patient, it's not a matter of punishing the surgeon. We have to figure out why and improve systems.
Well, exactly. I think the public actually is quite amenable to that after they, at a certain point. I mean, not immediately, because people do say, well, the surgeon screwed up. And most people think it's always the doctor or only the doctor that's at fault, even though most of the time people, when they talk about their own experience in a hospital, will talk about nurses
Mm.
because that is most of what you will see
That
when
is
you're in a hospital.
Yeah.
So it's under I think underexplored issues. The nurses are so critical,
Hmm.
and so, but people do understand and are very forgiving of the fact that people make mistakes, even when those mistakes are catastrophic to the patient. They understand it. They recognize that it, and what they want is full disclosure,
Hmm.
and they want to be able to contribute to making sure this doesn't happen to another patient.
Right.
They want to be part of the solution, the root cause analysis.
Yeah.
So it is goes against human nature in a way, and I understand it. But if a catastrophic mistake or any mistake happens at a hospital, you should disclose it,
Hmm.
admit it, apologize right away,
Hmm.
and say, we're going to do a full root cause analysis. We're going to interview you to find out what we did wrong so that it doesn't happen to others. I think that hospitals could pretty much eliminate their malpractice expenditure if they all took that approach.
Yeah. Yeah. And one other example comes to mind. Virginia Mason Medical Center in Seattle has shared a lot about how their medical malpractice rates have fallen dramatically
Yeah.
because of their improvements in patient safety through the use of lean and Toyota methods and other things. I know Leapfrog Group has
Oh, yeah.
recognized them for their success.
Oh, many times they have received our award. Gary Kaplan, their CEO, is actually the co-chair of our board's hospital advisory committee. We don't have any hospitals in our governance, but our board has an advisory committee of hospital leaders
Yeah.
from various parts of the country, different kinds of hospitals that advise us, so that we do have a direct conduit to the most trusted leaders in hospitals.
Yeah.
So
And
yeah,
Dr. Kaplan.
Virginia Mason is a great example.
Yeah, and Dr. Kaplan's been leader there for a long time, and it goes to show the importance of leadership.
Oh yeah.
And I'll come back to that in a minute. But one other thing I wanted to ask about reporting, there's all kinds of discussion that goes on about mandatory reporting of errors or infections, and that's something you've advocated. Advocated for? Can you talk about that?
Yeah, we have an advocacy campaign going on right now, which is there's more information on our website. asking Congress to mandate infection rate reporting by all facilities in the United States. And by facilities, I mean hospitals, ambulatory surgery centers, nursing homes, hospice centers, dialysis centers, any place where healthcare is delivered, we should have access to information about their infection rates.
Yeah.
And by infection rates, I mean acquired there or in most cases. So there is an ability to do it because maybe 20 years ago that would have been a steep climb. It still should have been done, but it would have been a very big deal to get that started. But now it is not. CDC has an enterprise where they already have the capacity to collect infection data, and they voluntarily, back to the voluntarily, collect it from a number of institutions, including nursing homes.
Mm-hmm.
But when they collect voluntarily, it's very, very few actually do report it. So ASCs and nursing homes are not required to report their infection rates, and so only a handful actually do. We can change that by making it mandatory. It seems like a simple thing to ask,
Mm-hmm.
especially in light of what we've been through in the past year with an infectious disease,
Right.
which is COVID, that we simply ask, we deserve to know your infection rate. So anyway, we've launched a campaign. We're working with AARP and a number of other organizations to get that moving. We welcome any supporters on that effort. We're trying to get it into the stimulus bill that just passed Congress. Didn't get there, but we're going to keep at it.
Sure. Well, thank you for that.
Time.
Yeah, well, thank you for that. And you mentioned the website, and people can learn more about that effort and everything else that Leapfrog Group does at leapfroggroup.org. So one other thing I wanted to cover here today, coming back to leadership and the role of CEOs. You mentioned Dr. Gary Kaplan at Virginia Mason Medical Center, another CEO who led by example and then also came in to help influence things in healthcare. Someone we both knew, and that was Paul ONeill.
Yes.
And so we often talk about him on the podcast here, of course, because of his role, with value capture and his healthcare advocacy. I saw one of the times I saw Mr. ONeill speak was at an annual Leapfrog Group event. You had invited him to speak in DC. I was wondering if you could sort of talk a little bit about your memories of him and what he did and what he shared, what happened when he was, from your perspective, what happened when he really tried to help healthcare out.
He spoke at our 15th anniversary, and it was a gala, so we had hundreds of people there to celebrate Leapfrog. It was a mix of hospital leaders and purchasers, so employers and other purchasers that are the backers of Leapfrog, as well as others in the industry, such as health plans and others, but mostly that mix of purchasers and hospitals, which is a unique group that's kind of unique because Leapfrog brings them together. But when he spoke, I think there wasn't a pin that you could hear drop in the room when he talked about the challenge he had in convincing his own employees of the importance of safety, and that he faced so much opposition when he tried to, create a safer environment in the manufacturing of steel. I mean, honestly, I thought that private industry was way ahead of healthcare, which it actually is. But I did think they were way ahead of healthcare in safety, and that there wouldn't be so much opposition. That of course everyone knows that you're not going to run a manufacturing plant without having excellent safety. But in fact, that was a battle too, and he did it, and he talked about what he faced to do that. And so it was, I think, both encouraging and discouraging for all of us in the room, because we were encouraged by the fact that we're not alone, that there is pushback. Safety is not, even though we all in theory know safety is important, it is not easy to actually make it happen in any kind of a group setting. And at the same time, it was discouraging because we thought, wow, we're way behind manufacturing, and look what he went through to get there. So, but he did achieve a great deal. He's an extraordinary leader, and I think he did bring along American manufacturing in ways that we have all benefited from enormously right now. So he is sorely missed. It was a very sad day when he
Right.
passed,
Right.
and but hopefully we can take up his example in healthcare, because healthcare really does need to make some major progress, and I think he was inspirational in the fact that we can do that.
Yeah, and in his words, and his message and the inspiration and the example he set lives on. You can still go watch video of him on YouTube. We've
Yeah,
published two ebooks, with transcripts of his speeches, and we didn't have access to the one from Leapfrog Group, but he had a very similar, consistent message in these different speeches, and a second ebook with reflections from people who worked with him or were inspired by him. So his impact, his legacy is going to be
extraordinary.
long lasting. But when hearing him talk about the leadership challenge at Alcoa, and I've seen similar things, people would agree to your point, Leah, that safety is important. It would be great if people didn't get hurt, but there's a certain rationalization that happens. So people say, well, this is just this is bound to happen.
Right.
It's sad but naturally occurring, and I think some of that may be a defense mechanism. It's easier to say, well, that's an unwinnable battle, except that it's not. So how do we open people's eyes to that? I hear similar, unfortunately, sort of self-defeating, self-fulfilling prophecy sometimes in healthcare circles related to infections or excuse making, and we can help people get past that.
There's a lot of excuse making, and there is a lot of, well, we're a complicated environment. Our patients are sicker. We hear this all the time,
Right.
and we have to expect a certain level of X, Y, or Z. And uh, I'm willing to accept that we can expect tragically low performance. I'm willing to accept that if you tell me that you've tried absolutely everything and no one else in the whole world has ever been able to accomplish better. But we're nowhere near that in healthcare. So we don't know, we don't even know the heights of excellence that healthcare can get to, because we're still pushing the market to get there. I mean, I think even a Virginia Mason, which I think is exceptional in terms of quality, they know, and they'll be the first to tell you that they aren't where they should be, and
Mm.
they need to push harder. So accepting poor performance is not good for anyone under any circumstances. We have to accept uh, we have to accept only that we aren't doing good enough, and we have to keep trying. And I think that was Paul O'Neill completely. And the other thing about Paul O'Neill is, which I was struck by in his speech, is that he often pursued policies around safety that were costly, that didn't make his board very happy, because they cost money, serious money. And people would look at him and say, "Are you kidding? You're going to invest all of that in this project? Don't you realize how much it's going to cost us?" And he would say, "No, that's where we're going to go." I mean, he was very clear, very principled,
Right.
and that is leadership. And that is what we need to see in healthcare.
Principled leadership. I'll invite more of that into every aspect of life.
Yes.
But yeah, I heard somebody describe the other day that leadership often requires making unpopular decisions, but yet still bringing people along. And Mr. O'Neill would say things. I've heard him say things like, "Well, we have no budget for safety." We talk about things like moral imperatives. I think similar to the phrasing he would use. He drove amazing business success at Alcoa. You see the two charts overlaid of
Right.
employee injury rates going down dramatically. The stock price soared. It's not a trade-off, and he
Right.
proved that. And I think that's a great illustration. Whether it's I think Dr. Richard Shannon, who's now at Duke University Health System, has demonstrated time and time again better quality leads to lower cost. That these are not trade-offs. We can have it all, and that's been demonstrated. To your point.
Yes, it's just not as obvious, and it's not as often as quick as other things,
Mm-hmm.
but it is far more successful.
Yeah.
It's just not as obvious.
Yeah.
And so, as a leader, you have to be able to see past the obvious and recognize the long term horizon and the true north. And that's where you head the whole organization. That's your job, is to move your organization toward true north. And that is right. That's exactly. He was able to keep himself grounded. We do a calculator to try it. It's really hard to show people how safety connects with costs, and it does in very dramatic ways. And we even can quantify that more. We have a free calculator on our website where an employer can use. They can enter all their admissions, and it's very, very simple. You just put your admissions in and your ICUs admissions. That's pretty much it. And we can estimate based on that and where your employees are going. We can estimate for you how much you're spending and how many lives are lost to safety and avoidable errors. So, I mean, that's just an example. We're trying to do that, to give people that direct sense. But then you have the leaders like Paul ONeill who are able to see that without having to see those individual obvious connections, to just recognize the larger picture, which is this is where we must go. And of course that's profitable because it benefits the whole company.
Yeah. Yeah. So one final question, Leah. When you mentioned True North. I know the True North of Leapfrog Group is, very strong and consistent. But with COVID, has that shifted any of your focus or priorities within that True North?
I think that COVID has actually reinforced for us the importance of our safety mission. I've been kind of struck by the fact that people don't seem to always see that. I mean, I feel like, isn't it obvious that we're recognizing how important it is that hospitals can control the transmission of infection? Don't we think that hospitals should have been the place we most trust in this country to be able to prevent infection from spreading either to their own workers or to other patients? We should have assumed that they were world experts at that. But of course, they're not, and we've seen that. I mean, they have nothing but absolute respect for the frontline workers who worked through that. But the fact is, that should have been something we solved a long time ago. They should have PPE, but that's only the first step. They also should have had the protocols and the culture in place that could prevent infections being spread. That is what it means to focus on safety day in and day out. It means that when something horrible like this pandemic occurs, you are prepared in a very profound way for what it will take on a day-to-day, hour-to-hour, minute-to-minute basis to keep everyone safe as possible within that environment. So I feel like this just highlighted the importance of safety and its role in keeping safe not only patients but workers, and how both are affected by focus on safety. So hopefully we will keep that on the national radar, but I've been, as I said, a little surprised that it isn't, that we have to kind of make that connection for people a little more often than I would hope. But we're going to keep making that connection because we have to do better.
Yeah. And nursing homes are one of the areas outside of hospital settings where there's still an opportunity. I think, COVID has highlighted, the risks of infection, disease spreading in nursing homes. There's still an opportunity to kind of focus on those same dimensions of cost and quality for people who are in that setting, right?
Well, between 30 and 40% of the deaths from COVID occurred in nursing homes. So I think it highlighted for all of us how important they are, and we have overlooked them. And so we are definitely going to be looking at nursing homes in the very near future. That is something we are working on right now to see if we can do some ratings and some public reporting around the safety of nursing homes.
Good. That'll be very helpful, I think, and again, a very important mission. So Leah, thank you so much. Again, our guest has been Leah Binder. She is president and CEO of Leapfrog Group. You can learn about all of their activities and important work that they do at leapfroggroup.org. So again, Leah, thank you so much for being here today.
Thank you, Mark, for having me.